Good morning. I bring in all the greetings and wishes to Dr. Dhaval Vasa for scoring topmost rank in NEET SS 2021 session in MCH Surgical Oncology. And I bring him all the wishes and greetings to you.
Thank you very much, sir. Thank you very much, sir.
So we want to know from Dr. Dhaval, where he comes from, where he did his MBBS and where he did his MS, and why he wants to do MCH Surgical Oncology.
Sir, I did my MBBS from BJ Medical College, Gujarat, Ahmedabad, and my MS from St. GS Medical College and KEM Hospital, Mumbai. And I'm planning for oncosurgery because I have seen patients in my family, as well as it was a passion for me to join this branch. What is the common notion we see is a person is diagnosed with a malignancy and they know that now they have 6 months, 1 year to live. And that is a common notion which I usually hear from friends, family, and many others. So I want to change that cancer is not the end of the world. If you are diagnosed with it, you can still have a better prognosis. You can still get a appropriate timely treatment and definitely improve your quality of life. And I am a very pro for screening, which is very less in India. So that is what, as oncologists, we should promote in future, so that there is a universal screening program throughout the country, so that we can stop this next probable pandemic.
Great. So, a great vision ahead, I could see, and your passion also is there for you to drive what you want to do. Now, can you tell us when did you start your preparation? How did you prepare? Can you tell us something about it?
Actually, I started my preparation during my third year of MS, but I could not get more time to prepare during that. So my major part of the preparation was during the bond year, which I was working as a senior resident at my parent institute, KEM Hospital. So I started my preparation along with it. I was with Speed since more than a year. I joined in December 2020, and I have been a part of it since then. And it has helped me to achieve a good rank in AIMS as well as now in NEET.
Yes. Now, can you tell us what did you do? During your bond period, you would have worked and also you have to read simultaneously. How many hours you are spending per day approximately for your preparation? And your preparation means what? What are things you did in your preparation?
Yes, sir. The goal was to spend at least 6 hours a day in the beginning, and last for during the entire year. And for the last 2 months, I had taken a break from my bond as my bond was completed and NEET PG was delayed. So I could get a good 12, 14 hours a day post that during the last 2 months. Uh, my basic focus was I had completed Sabiston during my PG time and Love and Bailey to some extent. Then I joined Speed and I started getting like notes of Sabiston Bailey. I used to read a topic prior to your class and then attend the class so that I know what I am lacking in my reading. Even if I have read the topic the same day, there were, I think, 10% of questions which I would not be able to answer correctly even during the class, or even when I was unable to attend the class during the video which I used to see afterwards. So that is what created, like, cultivated a habit of reading MCQ wise. And for Schwartz, personally, I just read only the MCQs and points which were discussed in your class, sir. Nothing else more than that, because I could not read more than that. And for oncosurgery part, I used to read it initially from Bailey and Sabiston, and then I could not read the entire Revita. I just brushed it a bit, and whatever notes which I get, I used to add them in my notes or in my book and revise the same.
So, were you able to attend all the live classes?
Not all, sir, but I think around 60% I could attend. But whatever I could not attend, I used to keep a note on the calendar that today is a day, this was a particular topic discussed, and I have missed it.
So you go back and see the recorded video.
Yes, I go back and see the video. I started seeing the videos again in the month of around June, July, when the NEET was delayed. So I thought I would have a time and let's just watch the videos at 2x speed and brush it up a little.
So you went through all the videos once in the app or
Once, definitely, some twice.
okay. So during your exam for surgical onco, how much meaningful it was, the videos and the mock test and the grand test which were given in the speed running app?
Yes, they were, could say, pretty helpful considering the oncosurgery paper this time it was, because it was altogether a different approach paper. So the topics were definitely covered, but the approach which was developed was the main turning point for me. Like how to face an MCQ, how to think from an examiner's perspective of point of view, and what the thought that you cultivated that, okay, if I am setting an exam, so what would I ask? That is what used to click in my mind every time while ruling out options, when I was confused between two options or so.
So, I mean, there was a lot of argument in every class. I mean,
Definitely, because that arguments and that point of thinking, that the approach to a question was that which I found very helpful.
and it was a lot of learning and a lot of fun. I mean, it is never like a kind of a forceful experience for both.
I used to feel sometimes guilty after the class that, okay, I have read this, in spite of that I'm not able to answer. So that, like, it was motivated me to read more specifically, concentrate on what topics actually I should read, what topics I should actually focus upon, especially the figures, tables. I never expected that a question can come from a footnote of a figure, a so simple question, which if I have read, I could answer easily.
Yes. So great. See, because it is a long drawn exam, it's almost 1.5 years, and to keep going with that phase is a little difficult.
Yes. The main hope I was, in spite of being like almost more than a year, almost 16 months, we were connected with speed throughout. So there was not a gap in the preparation. It was like continuously improving and improving till the last day of the exam. That is what I think made difference for me.
Yeah, I think we had even a day before the exam. One day before the exam, we had a class.
Yes. I know, and I unluckily could not attend those class because I was under the fear that I should sleep by 9. So I'm just shutting things off and just sleeping off.
Okay. How many questions did you attempt?
I attempted 97 questions, sir.
Great.
My goal was, as you said in your last video, that below 95 you are out of competition. So it was like, whatever may be the question, I'll rule out answers, take my chances, and attempt at least 95. So that was the goal, and I could attempt 97.
Yeah, I think that made the difference for the topmost rank.
Definitely, sir.
Probably 3 more questions you attended, you would have competed with rank number 1.
Retrospectively thinking, yes, sir.
Because that is a chance to be taken.
Definitely, sir. Definitely. And the questions I left were the questions from orthopedics, which I had, like, I gauged at that point of time, maybe the chances of getting it correct are very less as compared to getting it wrong.
How did you handle the onco and gynec, all those papers? I mean, all those questions.
Gynec and OBGYN, I read my UG notes, which I used at the time of PG preparation, and saw the notes in speed. I could not attend all the videos of speed, but I read the notes given by the faculties, and I solved the MCQs. So I would say I did not give a full dedicated preparation for all those allied subjects, but I definitely brushed each and every topic, and I revised whatever I had read. I did not do an extensive study, but a selective and more revision study. So that actually helped me solve majority of the OBGY and ENT questions. Ortho, I lost a few questions, but I knew that those questions may not be answered by most of them as they were PG ortho level.
Difficult for everyone.
Yes, sir.
So after you gave your exam and you were waiting for the results till last night, I mean, when the results will come, did you expect this rank?
No, definitely not, sir. I was a bit anxious because the paper was little unexpected. and what could be the result, because there was no clear cut. We could not, even I could not get answers of many questions after my recall. I had recalled around 90 questions, and my result is approximately the same based on what I recalled. But I also personally could not get answers of many allied subjects questions like ortho and OBGY. So I was also confused that what would be the result.
So end of the day, good climax.
Definitely, sir.
So you tell me, what will be a message to all the aspirants who want to prepare for surgical onco, and what will you tell them how to prepare? Because now the NEET SS, they are saying
Yes,
that's going to
definitely.
be 150. I mean, extended general surgery, and of
Yes.
course, CNES is going to be the same old pattern of getting a
Yes,
specialty
yes.
of 50, 60 questions and general surgery 20, 30 questions. And you tell me,
Yes.
what should they be mindfully, how should they start? Should they prepare for, start preparing from the specialty for NESS surgical onco, or first exam should be a NEET SS surgical onco? What will you tell them? If you would have been in that position
Yes.
today to start for the next exam, what will be your mind voice?
Frankly saying, sir, last time when the pattern was changed to 150 general surgery, I was very happy. The only thing was I don't have to read gynec, ENT and OBGY now, which was a big task for me to read all those subjects. But now definitely, yes, as the surgical group has been generated, so I would like to suggest that you read your basic textbooks in detail. You attend classes simultaneously, like you attend one class daily, like 2 lectures at the max per day if you are not able to attend live lectures, and rectify your mistakes. Go back and rectify what you have read. Go back and see what mistakes did you do, and give tests at a regular interval. Like I used to keep a test every Sunday during my last 3 months, sparing last 15 days of my preparation. So I know that based on tests, I did not get disappointed with my results, but whatever result I used to get, I used to use it as my motivation. So I think NEET should be the first priority if they are targeting even surgical oncology, because central institutes, the number of seats are definitely less. And the preparation should not be solely general surgery. It should be general surgery along with a touch of all super specialties.
Okay. And what about for, NESS? Because any student who will also want to have single preparation, many exams. That's how the concept has been all through.
Yes, yes, sir.
And because in NESS, they're going to target on 60% of questions or 70% of questions in surgical onco. And
yes,
what should be the approach for that?
I would say just read notes on oncosurgery. Don't run after DeVita now, as I would personally say I have read around not more than 10 to 20% of DeVita, and I just read notes. So whatever extra important of DeVita is there is uh, completely covered in the notes. No doubt in that. Even more than that is covered from a few other books like AGCC guidelines or MD Anderson, and all the books are compiled and given at a single place. So you just go after that. Don't waste time in reading the entire DeVita cover to cover, and simultaneously keep your preparation on for general surgery, because general surgery is also going to be a deciding factor in these INISS now. But definitely, if you're going subject specific, don't go too deep into that subject. Just focus on the notes. They are not asking so hi-fi questions. They are asking basic questions, and they are very well covered. Very, very well covered.
So, so you were reading the notes after watching the video, or straight away notes? How was your approach?
My approach was watching the video always first.
And
Until
revising
and
the
unless,
notes.
yes, and revise the notes. Read the notes once. What I used to do was, if the notes are like 60-70% already given in the books from what from where I have read the topic, so I used to add those points in the books or in my notes. I used to put pages in between. But if there was a particular notes which was like excellent, And it was like, okay, just reading these notes will cover everything. I used to just tick mark that in my book, and I was like, just read it from notes, open the app and read the notes. You are done with that topic.
Okay, great. Now, how happy your parents and how have you informed them the morning? Probably the results
Yes.
were late night.
Yeah, they were with me during my result.
Okay.
Actually, ranks were not given, so my parents and my brother were continuously scanning through the entire result to look whether what rank I have. I was not able to scan through the entire result, but I know they are very happy because they were there at the time of my exam. And after I gave my exam, I told that, okay, the exam is done. Don't ask me how it was. The paper was totally, I don't know from where they did. It was totally unexpected. But yes, it has gone, it went good, but I don't have any expectations now. But yes, we were all very happy, sir, after the result.
Excellent. And before we could say a great day. Can you tell us to the faculties and to the speed members? In what speed has made a difference in your performance? Has there an impact, or it made a difference or no difference?
I was ranked 127 last year, sir, and it is ranked 2 now. So that itself says everything. I had my colleagues who had joined Speed last year. Few of them, and it was recommended to be by a friend named Shivang. He was with Speed last year, so
he was a faculty also.
Yes, he was a faculty also, and he told me that, okay, you go ahead and don't worry. I was like, okay, I'll just listen to you and I won't worry, and I didn't worry now. So excellent for whatever help I have been provided, sir. The best commandment I would feel is there was not a drop in tempo of Speed in spite of many changes by the NBE or whatever the change was. It was always giving us a positive vibe that, okay, this is the problem for everyone. We are with you, just continue your preparation. That didn't demotivate me at any point in my over a period of 16 months. I was constantly motivated. Okay, the pattern is changed again. No issues. I have someone with me. So that is what I want to convey, sir.
Great. Thanks for the good words, because all this video will be seen by the faculty members also. Because they have put in an enormous amount of hard work, because whenever the pattern changed, they went to the new pattern, and the pattern changed back to the old pattern. Again, they went back to the old pattern.
Exactly.
It's a quick go back, and those scenarios are happening.
Yes. No, the faculty has played a tremendous job, sir, because it is we who expect from the faculty to guide us, and they have not left one stone unturned in doing that.
Thank you. They'll be definitely happy listening to this video, and on your behalf,
definitely, sir,
we convey the regards to them. And
yes, sir.
So, and once again, bring in all the wishes to you, and a great career ahead in surgical oncology in MCH for scoring topmost rank number 2 in NEET SS 2021. A long exam, a big exam after a very long time, and everything has come to an end.
Definitely, sir.
Finally, with a very good finish.
Yes, sir.
And keep moving, and keep in touch, and also invite you to be a resource person and a faculty in Speed in upcoming years.
Anytime, sir. Anytime, sir.
Okay. And God bless you.
Always my regards, sir.
God bless you. Keep going, keep rocking. And as a surgeon, enjoy your super specialty of MCH surgical onco. And what is your preference? What will you have an option now to choose? And what will be your preference now? Where are you planning to take?
Still not decided about any specific onco surgery preference, but it was my dream because I have seen my grandparents getting cured from cancers. So I was luckily with them when the result broke, and I was very happy that they could see whatever dream they saw, like as a child in me, I could fulfill that.
Wonderful, wonderful, doctor, and best wishes to you and your family. Keep going. Have a great career.
Thank you very much, sir.
Thank you.
Thank you very much, sir.
Bye-bye.
Thank you, sir. Bye, sir.